I know that all of you have in some way had a patient experience in the hospital, either as a patient or a relative or even just a visitor. And I can tell you I'm really, really pleased to be able to tell you today to have the opportunity to tell you about some of the things that we're doing to improve our patient experience. The National Inpatient Survey is undertaken every year throughout the summer, and it is a benchmark. It is information that allows us to be benchmarked against all of the trusts in England, and perhaps a little bit more relevantly against the trusts in our region within our SHA. Between 2008 and 2009, we were the most improved trust. We're doing postal surveys, which closely follow the inpatient survey. We get around 600 responses every quarter. But we're also doing in-house services. We're getting real-time patient experience data through our patient experience trackers, or PETs as I like to call them. These are little electronic devices that patients are given and are allowed to input. But we're also collecting PALS comments, the good and the bad. We're collecting the complaints. We hope that we don't hear about your experience in the newspaper, but we collect that as well. NHS Choices is something that's recently come online where you can go onto the internet and make a comment about one of our hospitals, and that's input that we really enjoy. All of this information is gathered and taken to the Patient Experience Steering Group, and I think that's really important because there's so many different strands of information. We really need to get them all together. It's at the Patient Experience Group that we can collate them and we can send them out to the divisions. And I assure you, at every single clinical level and at every single divisional level, patient experience is spoken about. And it's spoken about at every trust board meeting. We're very committed to patient experience. These are some of the things that we're doing. Now, reducing noise at night is something that we spoke about last year at the AGM, or something that you spoke about last year at the AGM. I bet that not many of you sleep in a room on a rather uncomfortable single bed with 3 or 4 other people in your room. Most of us sleep in a dark, private room with maybe one other person, maybe sharing a bed. And so it's always difficult to sleep at night time. We know that. But we're trying as much as we can to make it as nice as we can because people need to sleep. It's part of their healing. We have a silent night and a good night campaign, which hopefully you will have seen posters around the place. This is about encouraging people to speak silently, to walk softly, and a little bit of, just to show the integration of this, where the new dress code policy is going to say that we all have to have soft-soled shoes. That means that if I'm going out to the ward, I shall have to slip on my brogues instead of my little pointy shoes. And I've got this on here, which hopefully you can see. This is one of the things that we're doing because it's not just about noise, it's also about light. So something like this that doesn't, I'm a bit short for behind the lectern. A little light like this that a nurse can carry on her uniform means that she doesn't have to turn the bedside light on to disturb the patient. You can use these to take observations, you can use this to empty a catheter. Some of the things that the nursing care that needs to be done at night time can be done without turning the lights on. Nutrition is something that has been very topical lately, and rightly so. It is desperately important, and it involves things like 15 minutes before your trolley comes, you need to ring the bell, and that means to all of the nursing staff that now it's meal time, so you need to finish what you're doing. You need to get your patients prepared. You need to get your patients up, ready, sitting, those that need help. Perhaps they need help to go to the toilet, perhaps they need to wash their hands, so that in 15 minutes when the trolley comes up, your patients are ready. We've got red tray system, which you can see there. That's one of our actual red trays. The red tray means that this patient requires assistance with eating. So any assistance that a patient needs with their meal means that if they get their meal on a red tray, everybody can see that. We also have red jugs. And there's a lot of patients, especially when they're ill and especially as they get old, they don't necessarily feel the need to have a drink in the same way. Their thirst centre changes. Patients with dementia are often looking for something. And my colleague said to me today, if you try and imagine if you went to work without your purse or your phone, how agitated you'd be for the whole day. You've got all your keys, how are you going to get in? Imagine that. But these patients are often very agitated. And so if you can sit them down You can offer them a little drink, which is nice, but you can give them some keys, and it might be the keys that they're looking for. And the keys don't mean that they're going to run out. The keys just mean, I'm all right now. I don't have to keep walking around looking for something that I don't know. Yours is the most important voice. Yours is the voice that we're listening to.